Today, we're speaking with Matt Poole, provider at Dr. Lehman's office. Matt, thank you so much for joining us today. I know that you interact with a lot of patients, and many of them are suffering with chronic sinus infections. They're frustrated. They've been dealing with it for years. What are the most common things that you hear from those patients? What are they dealing with that really drives them nuts?
Yeah, that's a really good question. I wish there was one single answer that could encompass everything that I hear from patients, but I hear a lot. I would have to say the majority of the time when I'm talking with these patients, what they're telling me is it varies from having a very stuffy nose. They feel like they're not getting enough air in. A lot of patients also can complain of facial pressure and tenderness, a lot around their cheekbones and their forehead too. Some patients have things like watery eyes as well. It's also not terribly uncommon that people have headaches that they're complaining about too, headaches and migraines when dealing with sinus pressure. If I had to say the one thing that I hear the most regarding patient complaints with sinus infections or chronic sinus issues per se, would be that they simply just can't breathe. They're not able to breathe as well as they normally should.
Yeah, that does not feel good. And what I think is important for people to know is if you can't easily breathe through both nostrils of your nose, you probably should see somebody because we're supposed to be able to do that. Am I off base there?
No, you're absolutely correct. You definitely should. You should see someone about it. Most people feel like it's just normal and it's just another thing that maybe them and everybody else is dealing with, and they just have to go through the motions, but it is definitely something that should be seen and treated.
What's also interesting is there are people who get in a little bit of a rut maybe they go to an urgent care center, and the urgent care center provides the only thing they can provide, which would be maybe they're getting a Z-Pack, some kind of antibiotic, maybe a steroid shot or a steroid pack. And there are patients out there that's what they do. They may do that multiple times a year, and they don't know that there are permanent fixes out there. Is that correct?
That is correct. I see a lot of that too. The majority of the time when patients come to our clinic, they've already seen multiple providers, whether that's their PCPs or other ear, nose, and throat doctors in the past. And the general routine is that they come and they say, hey, I've been on this antibiotic for this many times out of the year. I've taken antihistamines before. I've taken chronic steroids, sometimes a steroid shot. It feels better for a little while, and then it's just back to the same old thing. And some patients it works on. A lot of patients need something a little bit more than that, so they're not dealing with this multiple times out of the year. And I don't like using the term Band-Aids, but sometimes for some patients, that's exactly what these antibiotics and antihistamines and steroids are. They're just Band-Aids to kind of get them by until that next big event happens, unfortunately.
Right. It's trying to fix the problem by only fixing the symptom as opposed to actually fixing the core problem.
That's absolutely correct. Yes.
So there may be patients out there that didn't realize that there were options for them. And now, today you have some minimally invasive options that are available even in the office setting. Is that right?
That's correct. We do all of those procedures in here in office. Yes, we do.
So it's important, I think, for patients to understand that if you are suffering with chronic sinus infections and everything you said, I know I used to deal with facial pressure, kind of sometimes it would almost feel like you had a sore tooth, depending on where it was, or you have that headache right above your eye or right below your eye. If you're having a difficulty breathing through your nose, if you feel bogged down, like you don't have energy, that's not normal. And a solution is actually relatively easy and available at the office of Dr. Lehman. Tell me, Matt, when someone comes in, is it pretty obvious to them? Will they know that there's going to be a solution or not? Is it easy for you guys to determine what the best course of action is?
Yeah, it's simpler than most people may think. We kind of have an idea within the ballpark of what's going on based off of patients' complaints, their previous medical history, what they've taken before, kind of some of their symptoms. I think when you combine a good history with a good physical exam, which we do here, evaluating all things, not just dealing with the nose, but throat, mouth, ears too as well. And when you combine that with our nasal endoscopy that we can perform, which is a little small scope that's very painless, that gives us a good view of everything going on within the nose and associated structures, as well as an in-office imaging, which we also do here, we're able to combine all those things together and pretty much figure out a simple solution for them if a procedure is going to be beneficial or not. And most of the times, the majority of these patients can definitely benefit from having it done for that population. Yes.
And what's great about that is this isn't a long drawn out process. You don't need 10 visits, going to different buildings for different scans. You're really, not only are you creating a solution for the patient, but you're also making it easy on them.
Yes, I think that's a major thing that I would like many patients to know is that, at some clinics, they may have, they're complaining of what's going on and they want to book them for a sinus CT and imaging, and they have to go outside to have that done. And then by the time they get it back, they have to make another appointment. And if they do have their procedure, sometimes it's in the hospital. Whereas here, having a balloon sinuplasty is as easy as coming to the clinic and leaving the same day.
Yeah, that's amazing. Well, Matt, I really appreciate you taking the time. I think that if there's patients watching this, the thing to walk away with is you should be able to breathe through your nose. You should have energy throughout the day. You shouldn't have pain in your face. You shouldn't feel bogged down by chronic sinus infections. And if you're the type of person that's going to urgent care centers over and over again, let that be a sign that it's probably time for you to book an appointment with the office of Dr. Lehman and see what kind of permanent fix is available for you. Thank you so much for taking the time.
Yes, sir. Thank you.